it is 2020, so something's bound to go wrong. Welcome to our seventh webinar in our COVID-19 webinar series, which are presented by the HealthMatters program in the Department of Disability and Human Development at the University of Illinois at Chicago through continued partnership with Project Search and their funding from the Ohio Developmental Disabilities Council and collaboration with Aspire Community Services in Illinois. We have today preparing your employees for the impact of COVID-19 updates from providers, and we're delighted to have Ed Call and Eligio Velasquez from ARCA at Albuquerque in New Mexico. Today, Ed Call is the President or Chief Executive Officer at ARCA in Albuquerque, New Mexico, and he came to ARCA in 1982 as a direct support professional. With Ed's leadership, ARCA has continued to thrive through reduced federal and state funding with innovative changes to service delivery and models. And then we also have Eligio Velasquez, who was named 2020 Direct Support Professional of the Year. And he has also spent all 26 of his years in the profession with ARCA, and he manages a group home where 3 men with intellectual and developmental disabilities live. So today, this presentation will provide an overview of the development of an infrastructure to prepare employees for disruption due to COVID-19 at ARCA, along with strategies that were developed to protect employees' health and safety in the workplace. Tips used to protect employees' health will be discussed, along with the impact of these strategies in their workplace. Essentials for employees, businesses, functions, and other critical inputs will be reviewed. Again, we have a large group today, so please ask your questions in a text box or a chat box. We will hold the questions for the most part until the end of the presentation, and then thank you again for joining us today. We are recording this session, and as always, we will make it available within a week of this presentation. So without further ado, Ed and Eligio, welcome, and I'm passing the presentation to you, and I will unmute you. Welcome.
Thank you, Jasmina. Ed? Hello?
Welcome. I can hear you.
Good. Welcome, everybody. Thank you, Jasmina. This is Ed Call, and with me I have Eligio Velasquez. We're coming to you from a very sunny, very hot, and kind of untypical, very humid New Mexico. So we are delighted to be with you today and talking to you about a very serious subject, of course. If you are watching the news, and I know everyone is watching the news, you know that right now New Mexico is sandwiched between 2 states that are really heavily into the pandemic, Arizona and Texas. Fortunately or unfortunately, we have 2 major east-west interstates that pass through our state, and we are seeing really spikes in New Mexico on those entry points into the state and in our major metropolitan areas. For those of you that don't know, much of New Mexico is very, very rural, which has also impacted our services and our response to the COVID-19 pandemic, because our Navajo neighbors, the Navajo Nation is a huge part of New Mexico, has had staggering amounts of COVID-19 within their population because of the fact that they are so rural and lack of electricity and running water and those kinds of things that makes family units have to work really closely with each other. So this has been a true journey for us here. And let me move through here because we're a little bit behind. I just wanted to talk about ARCA, the culture of ARCA, and I'll bring Eligio in to help us with this. ARCA has for 45 years been very, very involved in community-based services, and we've actually been doing services now for 65 years in the state of New Mexico. And one of the things that we have learned along the way, especially in a state that has limited resources, vast expanses of mileage and things like that, is that you have to embrace change. You can't avoid it. You just, when something's presented, you just need to take it on. So we've had to learn many, many years, and especially in this case, to listen and learn.
And just go with it. As it came down from Ed down to the home, we would listen, learn, and just like to do it. And it was, some days it was from one day to the other days where the changes were coming in. It was, we would learn it and do it, and then by the next day, we had new orders to follow. But that's what's good about ARCA, that we've always been doing that. We get things done, mandates are sent down from the state, and we've always just continued doing it.
One of the things that we were very fortunate to have in New Mexico was really strong leadership from our governor. And she is a former Department of Health secretary. In New Mexico for years. She went through 3 different administrations, 3 different governors. Then she went to Congress in DC, and now she's back in New Mexico as our governor. She was very, very forceful and very much on top of the response within the state of New Mexico from day one. She brought our Department of Health secretary and our Human Service Department secretary into those discussions, lots of teleconferences, lots of news conferences, lots of communication, and lots of communication on a policy and procedure level from the state for us providers to follow. So many times we were implementing policy and procedures from the state that were coming out on a 24-hour basis. And we were learning to adjust our models of service. We needed to stop on April the 14th. We got a message that we needed to immediately stop providing any services in the community, that we needed to close our homes, close our offices, only to essential workforce, and then move from there. And that was a dramatic change for us, a company that for 65 years has been trying to move people into the community, was now trying to keep people out of the community. So going back and re-looking, communicate to our workforce and compliance. And Eligio, do you want to speak about that?
And to the families and to the providers that did therapies and stuff like that, they could not come into the house any longer. That was a big change for the individuals and for the staff. But with days going by, they got used to it. And now they're thriving with doing therapies through the internet and doing family visits through FaceTime and coming to the window even and visiting. But that was the biggest change, because since I started ARCA, our mission was to open doors and go out and be part of the community. And then overnight, we closed the doors. And that was hard on the individuals and for the staff that were used to being out in the community. But as days went on, we've all gotten used to it, and the individuals gotten used to it. But we continue still being part of the community. As a staff, I take them out every day around 2 o'clock. We drive around Albuquerque. We go through drive-thrus and get a soda, lunch or stuff like that, and back to the house. So they're still being part of the community.
You know, one of the things that we immediately recognized within the company is that we needed to learn, and that was from top to bottom, myself, everyone else, direct support, the individuals we served, everyone needed to learn about what we were facing. So we used a whole variety of methods for doing that. we wanted to make sure that everyone was well informed. We immediately sent letters to every guardian, every family. We serve about 700 people on any given day. That was a massive undertaking and task in and of itself, but we wanted to have communication with those key partners as well as to what was happening. We dedicated a spot on our website so that people knew that they could check into that spot. There was a box where you could communicate directly with us without having to try to reach out to any one individual. So we did the same thing internally within ARCA. We developed a rapid response team. We picked 5 key members of our organization, myself, my risk and safety manager, some key service area directors, and we said, and our human resource department manager was a key member of that rapid response team. Once again, we sent that information out to our staff. We gave them a link that they did not need to go to any one individual. They could just email back in and ask questions and to be educated or address an issue, all those kinds of things. So we also went and we did training. And we said, you know, one of the things, once we were learning this process, we said we need to develop a training for our staff, and then we need to make sure that everyone who's working for us understands the same thing. So we immediately put up an online training, and we mandated that training. And Eligio, do you want to speak about the training?
Yeah, it came over the video, internet, and we watched it, we learned. I had a staff meeting where we all, through the internet, it was a staff meeting. Well, because, again, we could not have meetings in the house due to only 5 people in the building. So they all saw it. We signed training sheets, and that was it. It's like we learned and followed the directions and tried and did it to keep the individual safe and healthy.
The other thing that we did, we really worked hard on sending out fact sheets and little reminders. Looking at a reminder that says, wear your mask, a cute little image that has a mask on. I've been criticized a little bit for maybe over-signing things, over-signage right now, but this is not normal. We all have to learn new routines, and I don't think that that you can do too much to have too many reminders right now, because we're all trying to listen and learn. I've already talked about some of the things on the next slide. We established a response team. Once again, those are just once you're in an organization as large as ARCA, we serve people in about 85 locations residentially on any given day, all separate homes, separate locations. You have to have a way of having a quick response so everyone heard the same message, everyone heard it the same way. If they have questions because they did hear it the same way, can we clarify them? If we hear of practices that we don't want people to be doing because they think they're doing the right thing, and always it was because people thought they were doing the right thing, it gave us an opportunity to quickly correct those practices and get everyone in line, so we could say that we had a company-wide response that looked the same no matter what funding source you were, what types of regulations you were under. We wanted to make sure that the whole company was responding in unison. Lots of video communication. I have never been so videoed in my life.
Oh, me either. And then to learn it also, like I was not very technology, and now daily I have video conferences at least 2 to 3 times a day with therapists, guardians, case managers, supervisors. So it's it was a learning cycle for all of us.
One of the things that we implemented from the very beginning was to have daily meetings. That was in the early stages of the response. As I had mentioned earlier, we were getting new state mandates, we were getting new updates, we were getting CDC, we were getting OSHA, all the things that everyone else was getting as well out there that's listening to us. And we just simply said, you know what, we need to have our key leadership meeting every day until we know that we're in a place where we don't need to meet every day. And that's exactly what we did. We met about 2.5 weeks every day in the beginning to be sure that we were having that quick response and feedback and people talking and items that were coming up from our direct support staff were being heard, and we were building those into our responses. And then, you know, we flipped that around the other way, and we started to look at our written policies and procedures, which I think I'm a huge proponent of having things in writing. I know that there's an enormous amount of work when you do that because they can become outdated the next day. But if you don't have things in writing, to me, then I can't go back and hold this to a standard. We can't go back and say, are we doing the things that we should be doing in the order we should be doing that? And then to go back, so you're looking at processes and your infection control. We looked at our protocols, our employment protocols to deal with childcare issues, things like that, and because schools were being closed and all those things that we were dealing with. We had instances in New Mexico where our Native American communities were actually not letting people in or out. They closed themselves off, and we had staff that work in those communities, so we had to make sure that they had the proper paperwork so that they could leave their home and come to work and return back to their home. And then we started to work on developing a response and contingency plans for potential positive cases. Limit exposure. Eligio is going to have many things to say about us limiting exposure. You're seeing some of the examples of things that we did. The ever-changing questionnaire as new protocols and policies came out.
And that would change daily. The first couple of weeks, there was a signing sheet at the home, and they would bring them in, and it'd take a few days, and we were changing it again because we needed more information or different information on the form. And that was a challenge for the staff. It's like, okay, why are we doing this? And I had to remind them as a supervisor that it was mandated from the state that we needed all this information. We need to keep the guys safe. We need to know who's coming in, who's visiting. So if we ever need to do contact tracing, we have all that information there. So that's why the forms continue to change, and that's how we adjusted to that.
And on the screen, you're seeing a number of things that we did to change our culture, change the way that we operated as a company, all very foreign to us. The bottom one in particular, we experienced those shortages that everyone else did. We had food shortages in Albuquerque. We had the infamous toilet paper shortages. We had paper towel shortages. So we've never had a storehouse. We've never had anything to store supplies for us, and we had to put that in place within the first week of really starting to get into the pandemic.
And that was very interesting, that first week, because at the group homes, we don't storage. Every week we go and buy our supplies that we need. And we did. We ran out of toilet paper. We were running, as calling supervisors, that we needed toilet paper, paper towels. But we were lucky that we had a family member that did bring us some toilet papers to the group home, and we were lucky. Other homes, the company had to find the supplies for it. And
I think, one of the things that we did to just help everyone was to put signage at our entrances explaining our protocols, explaining our hand sanitizing procedures, the exposure questionnaire. We ask a variety of questions. Those were posted outside of our homes and our offices so that people would answer those questions prior to even coming into the building. Once again, a very foreign concept. We don't put signs on our doors. We definitely want to blend into our communities. We don't want to make ourselves stand out as being different, but in this instance, we reversed that thinking and went the other way just to make sure that we were implementing the facility access protocols to just keep the only thing, as we all know, the only weapon we have in this scenario is to keep people out. To not take away from those access points for families or things like that, but in order to keep the COVID-19 out, you have to limit access to your facilities. Of course, we had to go back and redefine our PTO policies, remote work policies, to blend them into the new federal regulations when the CARES Act were passed, to make sure that we were meeting those regulations as well, to be looking at people who have medical conditions that would prevent them from working or not in their best interest to work at this point in time. How do you accommodate those people? What can you do to hopefully have them still contributing to your mission, or to make sure that they are getting enrolled into the federal unemployment program so that they're still having ways to support their family. Working at home, teleworking, all those things. Once again, probably many things that everyone else is doing, out-of-state travel to high-risk areas. Did you have staff, Leo, that could not come into work because they had traveled?
Yes, we had staff that had gone to Florida and could not work for 14 days. And had to be tested before coming back.
And really looking at ways within your human resource areas to make sure that it's working for as many people as possible. Promoting healthy habits. That's a photo of me leaning back with my mask on, talking to one of our crew members who clean our offices, who's also an individual that we serve. So once again, looking at your health and safety from your hand sanitizers. You want to talk about what you do within the homes, Eligio?
Well, once they come into the home, they have to read the questionnaire. They have to sanitize. We have a sanitize station right there. If I don't remind them, one of my individuals that lives in the home will tell the person that they need to use the hand sanitizer. So that's really good that the individuals that we serve know that people need to wear their masks. They need to sanitize before they even come into the house. We still have vendors that can come in if we have emergencies in the house. And one of my guys did, stopped him at the door and made him put on hand sanitizer.
When we had the mandate from the state that we needed to test all staff, we were lucky enough to host a testing site, a drive-through testing site. Our state worked with us to do that because we have such a large workforce. And then we also trained our own nursing staff and got them fitted for N95 masks and all the PPE in order to make sure that they could safely test for us. And we all, I think we're probably singing a song here, the whole history of PPE. This morning on CNN, I heard that the state of Texas and the state of Arizona are running out of PPE. So we certainly have not solved that problem. And we ourselves yesterday started to realize that we're having issues with getting masks again into our organization. So we're reaching out again. In the beginning, we reached out to any number of community partners to help us, and they came through. Nail and hair salons, medical suppliers, dentists, construction companies all came through and helped ARCA in those first early weeks when it was just impossible. Thousands of handmade masks, or Bishop Storehouse came through with cleaning supplies, paper goods, and food.
And family members also, like my sister-in-law, she made tons of them for my staff at the group home and for my family. So, and she lives out of state with a special needs child of her own. So
we did storyboards, and I think we made hundreds of storyboards to send out to our residential homes for staff to work with individuals to help them understand the pandemic better. And as Lee was talking about, they are learning and they are becoming huge proponents for themselves, which is the best outcome that we could possibly have.
Yeah, at my home, I have an individual that works at one of our state placements, and he is afraid to go back right now, and he has that choice not to go back. So he made a choice that he would be going back at the end of July, and that's good with the team.
Yeah.
So,
once again, just making certain that we were disinfecting, that we were cleaning. We kept upgrading that. We went from 2 times a day to 3 times a day to every shift that we did deep cleaning within all of our environments, whether it was home or offices. And then we did contract with 2 environmental firms for deep cleaning whenever we would have a positive case. Communication, I can't emphasize more that communication is the key. You have to have everybody working together, understanding each other, and talking to each other. And that goes even to the whole thing about people who are afraid, people who are worried about their family members, their children. So we did, once again, a lot of video messaging, a lot of talking with our mid-level managers and giving them scripts and giving them talking points that they could talk to people. Eligio, do you want to talk about that since you're a mid-level manager?
Yeah, well, they sent out scripts. We had a packet where we reviewed several weeks at a time to have the individuals understand what was going on. And still today, they don't call it COVID. They call it the virus. So it's the virus that's out there. They're like, they can't wait until the virus goes away. They're ready to go back out into the malls, out to restaurants, because like we said, for 27 years, we've been taking them out to restaurants, to movies, to stuff like that, and walks and stuff. And now they're home. Well, they're still walking. I shouldn't say that they're not walking because health matters. So they're still doing their exercises at home, but out in the community.
One of the things that we really, then once we started to feel like we had our arms around some of those big issues, then it was, what can we do to make life still enjoyable? What can we still do to make life meaningful for people? So you're seeing a variety of things that we did to do that. And the big thing was to just to make sure that people are still having a productive and meaningful life. And there's many, many ways you can still do that without going out into the community. A good thinking point when you have these structures in place is to say, what are we going to do if this happens? What are we going to do if that happens? To be prepared, to think about when you have a positive case, how are you going to staff that home? What is your response going to be? What are you going to do when staff calls in and says, my temperature is elevated this morning? What are you going to do when someone calls in and says, I don't have any child care. Now that school is not in session, I don't have child care, or my child care provider is now ill. All those kinds of things. Can you share work? Can you work different shifts? Can you be flexible? Eligio, do you want to talk about being flexible with working?
It is. It's like we've had a lot of staff that have worked their shifts. They've gone to other homes to work because we've been short, and the flexibility and the commitment that my staff, I know that one of my staff is putting 20 hours a week extra to help cover homes. And I'm working longer days. I'm working with more of the individuals too. 'Cause in the past, they've been gone during the day, and now I have all 3 individuals at home. But the new thing is normal now. After 2 months, we've made a routine. There's a routine, and they're happy. They're getting up. They're still getting dressed. They're getting prepared for the day. They watch a little bit of TV. We do some exercises. Then they do their therapies. Therapists call all day long, different therapists at the house. So actually, they have a routine, and I think that's the most important thing, is to continue having routine and having them look for stuff to do. And we've continued to have parties, small parties, just the home. We had a birthday party just last week for one of our individuals, and he was so happy. His family got to video chat during the party. We had balloons and cake. And there was only 5 of us, but it was still a party, and he still was happy with what we could do.
You know, we had to really look at practices within our healthcare services department, our nursing departments, to say when individuals get sick, you know, at one point in time, about a month ago, our hospitals were full here in the metro area. We had people being flown in and driven in from the rural areas of New Mexico into Albuquerque, because it is the trauma center, it is the healthcare center for the state of New Mexico. Our hospitals were full. Our major hospitals, our major medical providers, all were working with people that had active cases of COVID-19. And so once again, looking at how are you going to respond to that? Can we do more things within the home? Can we do telemedicine? Can we do those kinds of things, and not have someone go in to a medical center? And if they do need to go in, then how do we manage that? Because we had
and we did a lot of telemedicine. Primary doctors calling, doing video chat, doing phone calls through for our individuals. And if they did need to go, we would prepare them. We put masks on, put gloves on them to go into the facility. But that was something different too, because we would never cancel appointments or not go to appointments. And again, this was a new norm that we had to do it through the phone or do it through video chat. And
I think one of the things that I may have slipped through that I want to talk about now is about, to be prepared. One of the things to be prepared for that we discovered was, how do you prevent people from being bored? Or how do you prevent people from still accessing their community in a safe way? And what would that look like? And luckily for us, for 12 years now, we've had what a contest, a health and wellness, because health and wellness is a huge issue, cultural thing for ARCA, is we have ARCA on the Move. And it's a walking contest with 10-member teams. I think we have about 400 people that we just finished our 14 weeks of walking last Thursday. And do you want to talk about ARCA on the Move and people participating and walking?
And Ed's in the top 10. He's in the first. I'm on the last 10, but we're still in the top 10, my team. But that's a nice challenge for the staff. I'm the captain for my team, and I send out little emails saying, we got to catch up to Ed and them, but we haven't. And that's something to keep us healthy also, and keep our mind distracted when we're out walking and trying to get those points to beat the next team. So my goal was to stay in the top 10, and we did it. We stayed in the top 10, so we're
way to go. And homes did different things. We had one home who made stones, They've decorated stones, and I'm looking at one sitting right on my desk. And she's singing. She has her microphone and she's singing. Every step you take, every move you make, you'll be counting it for ARCA on the Move, which was pretty cool. So I have that one sitting on my desk. People did really creative things to make people feel like they were contributing, being part of their community. We had homes that made thank you cards for the thousands of community partners who came through with everything from hand sanitizer to mask to gloves to just about food, just about anything that you could think of. We had community partners that voluntarily came in and contributed to those efforts.
And it's not just for the staff either. Our individuals participate in ARCA on the Move also. At my home, one of my individuals, he has like 150 miles, and that's really good.
Yes, it is. Yes, it is.
Yeah.
Yeah. And then to look at potential exposure in the workplace and how are you going to manage those situations where you need to quarantine or test staff and test individuals who potentially have been exposed. Our final little area is to talk about gratitude. I think it's really important that we all remember that we are part of a greater community and that part of our mission is to promote the individuals that we serve and their role within the community and for them to be seen as people who contribute to their community and not as people who are just taking from their community. So an interesting thing that happened to us is that we have a greenhouse operation. And this spring, we typically have like 18,000 geraniums and spring plants that we sell. We wait for them to blossom and then we sell them. We have a big celebration. We have many, many people that buy them in bulk from us. This year, I got the phone call from my staff when we had the last contract canceled. So we were sitting there with full greenhouses of blooming plants and nobody to buy them and no way for us to sell them. And we said, what can we do with this situation? And we decided that we were going to give them to people in the community, give them to first responders, give them to whomever. And there's a photo right in the middle, one of our board members and a major community partner, they set up a plant giveaway outside their front yard, and within a week's time, we had given away all 18,000 plants. They were all gone. They were all with people who were we could show our gratitude to them, and they could choose to show their gratitude to us. So it gets back to that whole thing about, ask for what you need and share what you have. We had 18,000 plants that were going to go nowhere. We could share that with our community. We have people making stones that are very cute. We can share them with people in our community who have done things to help ARCA. But also to look at what your employees, what they need, and how we can share what they have with our families, with our community partners, and with our leadership and with our boards. And I think that that's probably the best thing that has come out of this whole situation. And I don't know if
we got some of those plants for the staff too. So we handed them out to the staff and the staff were really happy with those.
Plants grown by the people that we provide services to, they were beautiful, they were blooming everywhere, and I can't think of a better way of showing gratitude. So we kind of took a situation where we were going to lose the money from the sale and all that, and we made it into where I'm actually really happy that we had the opportunity to do this. And we hear many ways, we're hearing back. So it bounced out there, and it's bouncing back in many ways that are beneficial to ARCA. Here is our email addresses, and if you would have any need to want to reach out to us, please feel free to email us directly. And with that, I think I'm turning it back to Jasmina for questions.
Thank you so much, Eligio. And Ed, it's pretty amazing to hear stories from our community-based providers, because they do speak to humanity that happens in the midst of it all. So I love the message of ask for what you need and share what you have. And I think it really it resonates, that ARCA spirit that we have known for the last 15 years working with the HealthMatters team. So thank you so much for sharing. I am opening the presentation to any questions from the attendees. Please put them in the chat box, and we're actually receiving some. Do you send out a letter or anything to people that may have been exposed through contact with an employee of yours that tested positive? Are you worried about liability? That's a very good question.
Sure, let me speak to that. Am I worried about liability? Yeah, I sometimes can't sleep at night worrying about liability. I don't have any fix for that. I don't think any of us do. None of us know what the court environment's going to look like. There's not test cases, though I do know that cases have been filed for wrongful death suits with long-term care facilities across the country, that those have already happened. I think we're all going to be learning as we go along what liability is going to look like, and I'm not trying to frighten anyone, I'm just stating a fact. I think that's just something that we're going to have to do the best with the best practices, with the knowledge that we have at that moment. I think it's important to document what you have done, to document what you're doing, and just have those. So have we had exposures? We have. We have had staff test positive. We have not had any of our recipients of services test positive to date. I chalk that up a lot to the things that we did at the very beginning and the practices that we have continued to enforce, to try and social distance if you can. If you have to do hands-on direct support, of course you can't socially distance, but then are you wearing gloves? Is the person you serve, are you wearing, you should be wearing a mask. You had better be wearing a mask, I guess would be a better way of putting that. And then trying to work with the people you're serving as well. Can they tolerate a mask for that period of time that you're needing to be hands-on support for them? We have done any number of, as much as we can, you know, the sanitizers, the cleaning of the homes, doing those things, trying to distance people when they're eating so they're still having a social event, but they're not necessarily sitting right next to each other. All those kinds of things. I don't know, Eligio, if you want to talk about other things that we've tried to do to do that.
That was something different too, because we've always, the home had family time meals, and now we serve the individuals, we let them eat, then we clean up, and then the staff can eat afterwards, because we're wearing our masks and stuff like that at the home. So then we eat after they go back to the living room and stuff like that.
And we've not had to notify anyone in the community because we've not had visitors into any homes that we have had exposure. When we do have an exposure from staff and they've worked in a home, of course, then we notify all staff. We notify them that they have had a potential exposure. Don't use any names, don't use anything like that, but we do notify them if there's a potential exposure. We require them to be tested on that day or within 24 hours at the very latest. They are limited to working in that home alone. So if they've worked in that home, they're limited to working in that home alone until we would get negative results back on all the individuals we serve and on all the staff that have worked in that home. That can become an issue. Do you have your systems in place to go back and check that you could? And we have 3 different systems that we now are reconciling that because, as you know, not everybody does everything that they're supposed to do exactly when they're supposed to do it. So we have sign-in sheets in the home. We're reconciling them back to our electronic system, and we're also reconciling that back to the recollection of management staff. Did they have anyone going into that home that could potentially have gone into that home that we still don't know about? That takes a lot of work. That takes a really focused, dedicated response to do that.
Thank you. I wanted you to talk a little bit more about employees and the impact of the pandemic on your employees. So we've been hearing reports throughout different service providers about dealing with staff shortages or staff working overtime, or did any staff quit out of fear? Can you just talk a little bit about that from your experience, obviously?
Sure. That's a great question. All of those things have happened. I think that what the takeaway has to be that that people make different decisions and they take different responses. None of them are wrong. None of them are better than the other. And I just encourage my managers and myself and my human resource department and people like Alivio that we focus on the positives, focus on what resources we still have, focus on working together as teams, and not just teams within the home, but every one of our support areas communicating to the other support areas. We have about 700 staff within ARCA on a good day. We don't have 700 staff right now, but are we all working together to make sure that we are utilizing those staffing resources as best as we can for the good of everyone served by ARCA, not just within a little siloed area, not just for someone to say, I have all my shifts covered, so I don't have any responsibility to the rest of the company. So really promoting that working together, and when you start to see the results from that, when everyone is seeing the results from that, then you can get that voluntary buy-in, and you get people voluntarily reaching out to saying, hey, you know what, we are well staffed in this area. Can we help out someplace else? Is there someplace else that we can send someone? I think Alivio talked about that a little bit earlier.
And then also that's something we talked about is when you guys had to close ACES, you put out staff at the home to help out with the shortages, stuff like that. So yeah, we haven't had to furlough no staff due to the pandemic because we had other places to put them. And it's not something new that we're short, because in this field, there's always shortage. So it's like, that's something that we've cycled throughout the years, of being short staffed, but you know how to manage.
Thank you. As a leader of ARCA, have you done video meetings with family members to address the changes or challenges?
I personally have not done that. That has been handled by my service directors or with program managers, mid-level managers, our caseworkers, our social workers, especially our caseworkers and social workers, that's their role, is to be working with families and having conversations with families and talking with families. So I personally have not reached out en masse. And part of that is that we have a variety of different licensing and funding, and those licensing levels within New Mexico have done different responses. And so it's not like a universal, necessarily a universal message. The overarching message is universal, but when people really want to know the specifics, and in those instances, I think it's best coming from people who are a little bit closer to the day-to-day than what I am. And you might want to talk about that.
And I've spoken through video to families, to the guardians, and told them about the changes of we can't have visitors, we can't let them go out with you, and stuff like that. And it's been positive. All the family members want their families to be safe, so they understand why we're doing this. And we haven't, in my case, I have not had no negative comments from any of the changes that we made. They've actually praised everything that ARCA's done to keep their family members safe.
And that's Eligio's experience. It's certainly not the universal experience within ARCA. We certainly have had family members that have been quite upset with us, family members that have asked for clarification and somewhat demanded a different type of response. We have simply gone back and shared state communications, state regulatory changes, those types of things, so that we're sharing as much information as we can with them. What we haven't done is equivocate on what the bottom line is, because that's something that we feel like we absolutely can't do, because that's jeopardizing the health and wellness of everyone that we're serving, all of our staff, everyone within the organization. So we have held firm. We have not, like I said, we have not equivocated on what we needed to do, but we've certainly shared information. We've certainly passed along contacts from the governor on down, Secretary of Department of Health, the director of the Developmental Disability Supports Division, given people lots of avenues to express their frustration with people who are making those decisions, and also express their frustration to us for enforcing those decisions. But that's the approach that we've taken.
Thanks. We have a bunch of more questions coming through, but I just wanted to put in our next July 14th, next Tuesday's webinar is continuing with the sort of reports from the community members, communicating COVID-19 updates to people with intellectual disabilities, caregivers, and stakeholders. And we will have a presenter from another community-based organization. And I've already put in the registration link into a chat box. Another question for you guys is, how have you been able to maintain the high level of precautions? This particular person, they found staff have started to get more lax as time has gone on.
Great question. You know, we experienced that lax last week. And I did another video message. For the first time, I was more stern in my video messages. I'm not necessarily a stern person, but I sent, to me, was a rather stern messaging to all of our staff, and basically saying that there's no gray area here, that it's black and white. What we particularly had was compliance with wearing masks. And we made a video, we gave examples. As we know, the wearing of masks is far, far more than just our industry. You know, we are all being impacted by the national discussion on all of these types of scenarios as well. But once again, to just simply say that ARCA has a zero tolerance. If you're not wearing a mask and you're at work, you will not be working for the company. And that was my video message. I have not received any negative feedback, and I'm always open to feedback from people. I don't know, Eligio, if you could talk about how that went over with the staff in the home.
They actually have not said much about it. They listen to it like we're wearing it. So they're like, because my staff, every time I'm there, they're always wearing their mask. So they didn't see anything with that. They're like, okay, we'll continue. We're doing it. I
think that the message is that we have to be vigilant, and that we can never rest. And I think that we had rested, and I had rested a little bit, thinking we had put things in place and that was going to be carried forward. We already have started to experience that's not the case. So then it comes down to compliance and monitoring, and are you checking those overnight shifts, and are you checking into the homes at unexpected times, and can you do video monitoring? Can you ask somebody to turn on their video on their phone, and maybe they're talking to you without a mask on, and we could have a conversation then. I think it's something that we're all going to be learning as we move ahead.
Thank you so much. We are at the hour, so I don't want to keep attendees on. We will continue, just if you can hang on for a couple of more minutes. There are a couple of more questions, but again, thank you and apologies for a little bit of a technical glitch. Have a great rest of the day, and hopefully we will be seeing some of you next Tuesday. Ed and Eligio, there is a couple of questions. One was, someone would like to find out how they're setting up your walking club. Thanks, Robin, if you're still on.
Sure. That would probably be best be answered if Robin would want to reach out to me and just send me an email, and then I can hook her up with our walking expert. That would work best.
Okay, Robin, I'll connect you two through me, so no worries. Okay, that would be great. And then there was a little bit of a specific question was, how are you handling communal items such as ink pens, markers, etc.?
We have alcohol wipes, and we're wiping pens and stuff like that. We have bleach wipes and wiping. Here at the office, when people come in, you take your temperature, you sign in. There's little swabs that you need to clean off your pen, clean off the thermometer. So it's all with alcohol and Lysol wipes.
That's a great answer, Hill.
And sort of a final question would be, is there anything that you wish you could have done differently, or sort of like looking into future and realizing that we are still in the pandemic and sort of just future planning for, the second wave, if it's happening, or just resurgences? What are your kind of like last words of advice that you would like to leave us with?
Wow, that's a really good question. I think that to be prepared for the totally unexpected, and that's really difficult, because that's not being a human. Human beings really rely upon structure and repetition and things like that's how we live our lives. I think that was I'm proud of our response, but I think the hardest thing was just dropping the dime, so to speak, to say we need to move, and we need to move now, and we need to start building all of these structures, and we need to start. That was the hardest thing to do. I think that what we need to build upon is kind of a motto of being open, being honest, being flexible, being patient, being firm, and being consistent, and trying to refocus our company culture around those values. And I think that's going to give us a building block to move forwards, because I am in agreement with whoever asked the question. We've not seen it all. There's going to be more, unfortunately, and we have to be prepared for that.
Thank you so much for this wonderful hands-on from the providers look on real-life stories and how you're handling everything. Again, thank you for all the participants for today. And there are no more questions. If there are any, we're going to stick around for a couple more minutes, but feel free to sign off. Like I said before, we are recording everything, and we will make the PowerPoint and the recording available within a week. Have a great rest of the day, and thank you so much, Ed and Regio.
You're welcome. Thank you.
Thank you.
Thank you. Have a great day.
Already, we will. Should we leave the event, Yasmina?
Feel free to leave. No more questions coming through. Thank you.
Great.
We'll chat
Thank
soon.
you.
Thanks.